Hi, Kevin Henry, the Group Editorial Director for Advanced Star and Dental Products Report, and I'm here today with Dr. Harvey Silverman. How are you doing today?
Kevin, doing great.
Good.
Pleasure to see you again.
It's great to see you. Tell our viewers a little bit about yourself.
Well, I've been involved in the field of aesthetic dentistry for quite some time now, developing various products from one of the original porcelain veneer systems and patenting the original OTC tooth whitening system, and even having developed and opened up the country's first dental spa back in the 1980s. So I'm definitely showing my experience and my age with that. But we're here today to talk about our newest system, and I'll let you.
Well, and actually, that's what I was going to say. Tell us a little bit about EasySmile Lifelike Veneers.
Okay. Well, the problem that dentists have and patients have had with conventional porcelain veneers is it takes a lot of time, it's very expensive, as we all know, and that's typically the main reason why patients don't want to go ahead with work. Even though there are some procedures today which are minimally invasive, and many are still relatively invasive, patients don't want to have their healthy teeth, in their words, quote unquote, filed down just to make them look better. So I looked at that, and I looked at all the other issues in terms of why, when a patient would come in for one or two veneers, why were dentists, colleagues of mine that I talk to on a regular basis, why are they always suggesting doing 6, 8, or 10 veneers?
Right.
And what happens when we say that to our patients is the patient will say, let me think about that. And you know what that means?
Yeah.
It means
they're gone.
Yeah. So over the past 20 years, I've been working at developing a new way of doing a in-office veneer without having to go through tooth reduction, but still have a perfect emergence profile. Now that sounds really difficult to do, and it is, but it was difficult to accomplish that, but it's easy to clinically perform today. And that's because of advances in technology and the EasySmile Lifelike Veneer process. It's a huge breakthrough in how dentists are able to transform smiles. I also wanted to be able to help patients transform the smile in one visit without having to do 4, 6, 8, or 10 teeth.
Right. And
this, dentists know, and we all know this as a fact, that one of the most difficult things to do in all of dentistry is a single veneer, or a single crown, but just getting it to match the adjacent teeth is such a challenge. So with the EasySmile system, we actually can create these veneers in just minutes. They're not preformed veneers, so that's a huge advantage, because you can literally make these veneers from scratch, and it takes only 2 minutes, which you will experience again in just a little bit.
Yep.
But you can literally make a veneer that perfectly matches and blends in with the adjacent teeth, whether it's 1 or 2 veneers, in just minutes. And the whole process from start to finish, including finishing and polishing, is 15 minutes.
Nice.
So it's a pretty cool system.
Well, it's a cool system that, you and I have talked a lot about this, and it sounds like something that would be pretty easy to market to patients. And obviously, they're not going to have to worry about all their teeth or part of their teeth. They're just going to have to focus on that one that's really giving them a problem.
Yeah, we've done studies on that, as a matter of fact, Kevin. As over the years, as I've consulted with other dentists who wanted to take the cosmetic dentistry practice to the next level, we found typically dentists will say, most of the patients who wanted or needed cosmetic dentistry in my practice, they would tell me they've already had it done. And I challenge them. I'd say, I'll tell you what, we're going to pass out this special smile enhancement form. We'll test it first, even with your team. Let's have your team fill out the form. And I would predict that 8 out of 10 patients, it's still in your practice, have at least one tooth they want to change the size, the shape, or the appearance of. And that has happened consistently and predictably in every office. And then when they work with their team, the team members then work with the patients, we find that there's a latent demand for cosmetic dentistry that even the most active cosmetic dental practice can still expand his or her cosmetic practice if you're using the right tools. But that's the key, is having the right tools.
Well, you mentioned team, and we're going to talk about that here in a few minutes, but why don't we go ahead and let's get into the technique, and you can show people how amazing this product is.
Okay, so what we're going to do is we're going to do a smile preview veneer on you. Okay. And it's going to take 2 minutes, maybe less, okay. And then we'll be able to look at your before and your after.
Okay.
Okay?
All right, we'll give it a shot.
So what I'm going to do is, can you come up a little close on Kevin's teeth, please?
All right, so here are my teeth before we do the procedure.
What we're going to do is take this special foundation material and use our patent pending, we're going to create a patent pending smile preview to see whether you like the size, the shape, and the appearance. This is great for dentists to be able to do to the patients, because instead of doing computer imaging, which kind of gives you the best guess as to what we might be able to accomplish on a patient's teeth or in this a change in smile, we can now determine exactly how this can transform your smile by creating a smile preview veneer. And the best part is, literally, it takes only 2 minutes.
Okay.
So let's get the watch out.
All right.
And we're going to go ahead and we'll create the smile preview veneer, which is totally reversible. If the patient doesn't like it, I'd rather know in advance before we take on the case. And you also want to be able to pre-qualify the patient, checking the bite and making sure there's no interferences. And there's a litany of things that we look at. But for purposes of now, let's just go ahead and make the smile preview veneer.
Okay. All right, so it took less than 2 minutes. I now have a veneer on number 10. Right there. And Dr. Silverman, I think you said that you were going to pop it off now.
Yep,
that,
because we want it to be a preview veneer. Now, in your case, we also used a slightly lighter shade because we talked about the fact that you were looking to whiten your teeth as well.
Absolutely.
So this way you can determine, is that the color whiteness that you want your other teeth to be in that same family of shades or not? If you want to go a little lighter, we can create another smile preview veneer that has even a lighter shade. But if you want it to look natural, you can create and help us co-diagnose what it is that you're looking to have, because cosmetic dentistry is definitely want-based.
Right.
It's not need-based. So we want to know, what does the patient want? Not what you necessarily need in terms of your cosmetic concerns. It's what do you want when it comes to cosmetics.
Gotcha.
There's a big, big difference in that. Okay. So let's go ahead now and pop off this veneer.
All right.
And it took, what, was it a minute 35 seconds?
I think it was a minute 35. Yeah.
So here we go.
Okay.
Pop this off. Okay. And check this out, ladies and gentlemen. This is his veneer. And if you, I'm going to put this down. If you look at this next to the tooth, look at how translucent it is. You can see my blue glove there. See that? And it looks just like a veneer. Look at this, Kevin.
Absolutely.
And if you look at how incredibly thin this is. It's contact lens thin in the true sense of the word. So therefore, you've now personally experienced what a smile preview veneer is. And again, this shows you the translucency, and it's incredibly thin. And it's actually, we like to call the seeing is believing, because when I told you first, when we talked on the phone about how we can create a veneer in 2 minutes, your reaction was very typical of most people's reaction, which is, you got to be kidding, how do you create a veneer in 2 minutes? If you're going to do something chair side, and if for instance you use conventional bonding materials, it can take you 30 minutes to 45 minutes between putting on your dentin shade, your enamel shade, incisal shade, and in some cases you have to use tints or opaquers. With the EasySmile system, it is so thin, yet it masks out the underlying discolored tooth structure. And I already have an example of a typodont with a case like that, where you can see the discolored tooth over there, the lateral incisor. And I made a veneer, which again, let me show you, is incredibly translucent. Let's see the finger, the glove, very thin. Yet, even though it's translucent, somehow it's able to mask out the discolored tooth, which you'll see when you put this on top of the tooth. You can't see the discolored tooth. That's pretty cool. It's almost a contradiction in terms, being translucent, yet at the same time being able to mask out the discoloring tooth structure. And that's the advantage of the EasySmile system, because I personally don't know of any other system that allows us as dentists to be able to determine before taking on a case whether or not we can meet the patient's expectations. That's the biggest problem that we have in cosmetic dentistry. Can my skill set match your expectations in terms of what you want to have with respect to your smile transformation? And with this patent pending smile preview veneer process, we're able to see exactly what, it's not close to, it's exactly what you're able to achieve. Because if you like this, all we have to do now is heat process the veneer and then bond it in place. It's obviously there are a few other steps, which I don't want to get into right now. For anyone who wants to be trained in the EasySmile system, for DPR readers, we're doing a complimentary 30-minute hands-on training webinar. And the reason we're doing these hands-on training webinars is that it's hard for me to travel all over the country. And we've been training dentists as far away as Barcelona, Spain, Mexico, outside the United States, and so forth, in addition to training dentists throughout the U.S. But you're able to, with the webinar format, working on a one-to-one, or basically the most we allow to work with us at one time is 4 dentists at one time work with us, and we send you the foundation material, so there's no charge on that, and we train you, and you'll make, by the time this 30-minute webinar is done, you'll be making your own EasySmile veneer, just like I did for you. So it's pretty, for any of the Dental Products Report readers, again, it's a complimentary offer for a limited time. So today is October 1st, 2014. And so in several years from now, this offer won't necessarily still be available.
And how do they get that offer?
Well, the best way is to go to our website, which is www.silvermaninstitute. Let me spell that, silvermaninstitute.com. And you'll be able to also, while you're on the website, you can sign up for the program, and you can also read why other dentists are excited about how this is transforming their cosmetic practice.
And also, I want to mention that if you're going to the Greater New York meeting, Dr. Silverman, you'll have a booth there, right?
Right. Our booth at the Greater New York meeting is actually booth number 5311, and we'll be happy to we'll be performing hands-on training programs during the Greater New York meeting, and we'll be doing meet and greet so we can help you with your team questions and concerns, how you can expand your cosmetic dentistry practice. Even if you haven't done any cosmetic dentistry recently, and I'm talking about elective cosmetic dentistry, we can get you to do at least 200% more than you've done in the next 30 days once you use the system. It works with predictability. Some dentists do a lot more than that, but on a conservative basis, you'll do at least 200% more cosmetic dentistry than you previously have done, no matter how much cosmetic dentistry you have been doing.
And I teased a minute ago that we were going to talk about the team, and we're going to do that in our next video. So be sure to click on the site and search for Silverman. You'll be able to find it that way. Dr. Silverman, thanks so much for your time. I really appreciate it.
My pleasure, Kevin, and look forward to seeing you again.
Absolutely.